Together we achieve victory over heart failure.
Hello everyone, I am Dr. Kshitij Bedmutha, consultant cardiologist practicing in Navi Mumbai. Today we are going to speak about one important aspect of cardiac care, that is heart failure. Heart failure is a condition which is very difficult to notice. Basically, heart failure in simple terms means that heart faces increased strain, so it has to compensate by working harder. As the heart failure progresses, its ability to pump the blood diminishes gradually. Over time, subtle changes may go unnoticed, emphasizing the importance that we have to recognize the heart failure symptoms urgently. Some of the common symptoms which you will notice is swelling in the feet, ankles, and abdomen, sudden weight gain, breathlessness on exertion, shortness of breath, difficulty in sleeping. You get tired while doing small amount of work. You feel breathless while sleeping. So these are some of the symptoms which can indicate that you may be suffering from heart failure. Other symptoms like rapid heart rate, low blood pressure can be detected by a medical care person. If you notice any of these signs, prompt medical care is warranted. There are three important aspects which you should know for the heart failure. One important aspect is the blood pressure. Normally, the blood pressure for individuals should be between less than 135 to 135 systolic and 85 diastolic. Any blood pressure which is more than that is a risk factor for developing heart failure. Second important factor is the lipid profile. Lipid profile specifically, we look for the bad cholesterol, that is the LDL cholesterol. There are various guidelines for the bad cholesterol, but for practical purposes, for people who are younger than 20 years of age, the cholesterol, that is the bad cholesterol, LDL cholesterol, should be less than 110 milligram, and HDL cholesterol should be more than 45 milligram. For anybody older than 20 years of age, the LDL cholesterol should be less than 100 milligram. Third important aspect which you can monitor easily at your home is your heart rate or the pulse rate. Typically, the heart rate or the pulse rate during resting time should be between 60 and 100 beats per minute when you're calm and relaxed. For moderate exercise, we aim to achieve 85% of the maximum heart rate. The maximum heart rate can be calculated by subtracting 180 minus your age. So if your age is around 35, so we can subtract 180 minus 35, that comes to around 155. So whenever you are doing exercise, the heart rate should increase to 50 to 85%. So these are some of the important parameters which you need to track for your cardiovascular health. We have discussed about your blood pressure, the cholesterol levels, and the heart rate. We had also discussed about the signs and symptoms that helps us to recognize the heart failure problem. So this concludes today's discussion on monitoring heart failure conditions. Remaining proactive is the key to safeguarding your heart from heart failure. Thank you.